everyone, welcome back to my channel. Today's topic is going to be about the epidural. Now I know there are so many misconceptions out there regarding whether it's safe to get one or whether it's going to harm the baby and how it's going to affect the body, but I'm here to discuss with you my personal journey with the epidural, what it meant to me to get one, how it affected my labor, and how it affected my baby. And so let's jump right into it. My name is Sweeta, I'm a registered nurse in the LA area and a new mommy here to share my experiences with you all. So welcome to my journey. Giving birth is one of the most intense and painful experiences a woman can endure, especially if she's pushing out a 5 to 10 pound baby from this very small birth canal. This can often test physical limitations of the female body and physiological changes such as drop in blood pressure, increase in heart rate for the mom, increase in heart rate for the baby, even a drop in heart rate for the baby. And so proper maternal pain management has become a very important part of the modern labor practices that we have seen today. And in recent years, the epidural has become like the most popular means of pain relief during labor. So what exactly is an epidural? Basically, it's the process of administering regional anesthesia and medication directly into the epidural space of the woman's spine. And usually the epidural space is an area which surrounds the spine and is filled with fluid. And the nerve pathways will conduct pain response and other sensations from the brain to the lower body. And so this is a perfect place to numb that area, especially during childbirth, so that the mom does not feel the pain from the lower half of her body. Mostly the stomach down. It basically blocks all those pain signals and the receptors that go to the brain and back down. The number one pro of an epidural is obviously pain relief. Who wants to be in such excruciating pain for hours while pushing a baby out of a very small birth canal? I mean, since I've been through it, I can assure you personally that I would probably not give birth without an epidural in the future. Like if I get pregnant again and have to go through it all over again, I would definitely request an epidural again, because those contractions are very painful. They are 100 times more painful than a period contraction from my standpoint. I mean, I'm telling you, there are probably women out there who are like, oh, I gave birth without an epidural, no problem. If that's one of you, then I salute you, because I don't think I can ever do that. I really needed that epidural during my labor. And it's a highly effective pain reliever as well, because once the epidural goes in, almost instantly within the first 15 minutes, there's a major relief of pain. And another reason why getting an epidural is a pro is because it allows the mother to stay awake. This is very important so the mom can get focused on pushing the baby out. And another critical benefit of getting an epidural is that in case the mom needs to go into an emergency C-section, she already got that epidural, numbed the whole bottom half of her body, and can go straight to C-section without having to wait for the anesthesiologist to come in and give her anesthesia for a C-section. So the three major pros that we just discussed about today are effective pain relief, which is number one. Number two is that the mother stays awake and is able to push. And number three is that if in case the mom needs a C-section, she can just go straight to the C-section and not have to worry about waiting for the anesthesia, especially if there's something going on where the baby's heart rate is decreased or there's trouble with the baby. So you just want to get that baby out right away and not have to wait for anything or anyone. So now let's discuss about the cons regarding getting an epidural. So basically, you can't really get an epidural until you're 4 to 5 centimeters dilated, so you have to endure the physical labor pains, contractions, for those first 4 to 5 centimeters dilated. And another con of getting an epidural is it can lower your blood pressure. So if you already are hypotensive, it can further drop your blood pressure, especially during child labor. Like if your blood pressure is 90/60, it can further drop it even lower to like the 70s or 80s. So that's something to keep in mind. And another con is that women may experience headaches because this medication is going to your spinal cavity in the epidural space. It can change the homeostatic shift in fluids and you can get a headache. It just comes with the process. Another con, ladies, is urinary infrequency. which means you can't really feel if you gotta pee or not. So most of the times, once you get an epidural, you most likely will be getting a Foley or urinary catheter, which is just a tube that gets placed inside to your bladder, and all your urine will just come out, flow out on its own into a little bag that's placed below the bed. So that's another thing to keep in mind. And although very rare, another con to getting an epidural is infection. Sometimes if the anesthesiologist doesn't properly sterilize the epidural or the spinal space and gives you the epidural, infections can occur. But again, according to the CDC and other research that I've done, it's very rare. Another major drawback with getting an epidural is immobilization on the mother's part. So basically, she can't really move or walk around the unit trying to get that baby down and, you know, get the contractions going. So once you get the epidural, you're basically going to be staying in the bed. Your nurses will turn you every 2 hours for comfort because, you know, you might get numb on that side, whichever side you're on. And so just to keep in mind, this can happen. The last con that we need to talk about, just to get it out there, is that sometimes getting an epidural can prolong the birth process. It can slow down your body's natural pushing mechanism and kind of slow that process down so that you're maybe pushing longer, and so there can be effects on your body and your baby's body. There can be risk for birth injuries, so just look into that as well. And so now from my personal experience with the epidural, let me tell you, I had dilated probably 6 or 7 centimeters until my nurse said, "Oh, you've dilated so much so fast, let's get the epidural." And I was like, "Please, I've been asking you and I really need it." And so I finally got the epidural when I was about 7 centimeters dilated. I endured all that labor pain. It was the most excruciating pain ever. I had gotten a couple of doses of pain medicine to help me in the meantime before I got the epidural, but that didn't really do anything until I got the epidural. Now, my personal choice for getting the epidural was to help me with pain relief because my labor took about 32 hours. I was in so much pain without getting any proper rest or sleep, and it was just a very long and grueling process on my body. So my personal choice was to get that epidural and just make it a little bit easier on myself so that when I do meet my baby, it'll be just pain-free, let's just say. So that's why I chose the epidural. I did research beforehand. I asked my friend who is a labor and delivery nurse the pros and cons as well. We had a lengthy discussion on the phone, and with all that said and with all that research, I finally just said, let me just get the epidural and try to make my birth process a little bit easier. And so that's my personal story with the epidural. It did take me a little longer to push my baby out, only because I was so numb, and it took me about 2.5 hours to push my baby out. And so that does prolong the actual birth process, I'm not gonna lie, but it helped me with the pain, and that's really all I wanted because that pain was so hard to endure for me at that moment. And so thankfully no birth injuries occurred with my baby. My doctor, my OB, she wanted to use a vacuum to suction her out because she wouldn't come out. It was just, I was so numb, but I finally just gave in and pushed my hardest, and she came out, and we met, and it's almost 2 months later, and I'm a new mommy. And so I have yet to share my journey on new motherhood, which has been beautiful, although it does have its ups and downs, of course, but that will be for another video to share. So stay tuned for my future videos on new mommy life, newborn life, and newborn care, because that's a whole another thing that I'm still learning every single day. So if you like this video, please like it, subscribe to my channel, hit that bell icon so you can get all future updates, and keep watching my journey. Thanks guys, see you later.